My name is Dr. Eric Liu, and I'm a surgeon here at the Rocky Mountain Cancer Centers here in Denver, Colorado. So let me tell you a little bit of history about neuroendocrine. In fact, that's not the name we called it when it was first discovered. Back in 1907, a German pathologist saw this kind of cancer, and he said, this is definitely cancer, but it's not the cancer I'm used to. Breast cancer, lung cancer, colon cancer. So he called it a carcinoid, which was a carcinoma or cancer-like. Well, unfortunately, that term stuck for 100 years. And a lot of modern healthcare providers, when they learn about carcinoid, which is an older term for neuroendocrine, they think that's a benign disease. But frequently, it can metastasize to the liver or the bones, making it not benign, making it malignant. And so in 2000, a new term was created called neuroendocrine. It's kind of the blanket term. So any kind of a neuroendocrine tumor that comes from a tube, like the breathing tube or a digestive tube, traditionally, classically, was called a carcinoid. We're trying to get rid of that term because a lot of people, unfortunately, think it's benign. But now we use the word like small intestinal neuroendocrine tumor, bronchial neuroendocrine tumor, and that's the phrase we like to use. Neuroendocrine cancer is really a family of diseases. It's like 70 to 100 different varieties of cancer. In general, it tends to come from the small intestine and the lungs, and they can be very, very slow growing. But neuroendocrine can also spread very quickly. It can spread to the liver, the bones, the tissue, and many other places in the body. And so it's very important to see a specialist who understands how to take care of neuroendocrine because there's so many different types of therapy. Now, the cancer part of it, many oncologists understand. But there's also another aspect to it, the endocrine portion, in which the tumors secrete hormones and cause many weird symptoms. So people can have flushing or diarrhea or asthma or cough or blood sugar problems or even rashes. So these kinds of symptoms can be very challenging to control. And so being able to see someone who understands neuroendocrine, not only from the tumors and the masses and the growth perspective, but also understands the hormone perspective, is really someone you need to seek out because that's the only way you can get total disease control. Call my team today for an appointment